Hello, everyone. Welcome again to another edition of Lupus Talks. Again, this is another day. Today is Tuesday, ladies and gentlemen, July the 7th. We call 7-7 or the double sevens. We want to make sure that you guys have everything that you need on this level of growth as we continue our growth series. Education, uplifting, and giving you the full facts as to what you can do for those who are suffering from autoimmune disease or people you know who are suffering from. How do you ought to treat them, and how do you ought to communicate with them and help them any way, fashion, or form. But again, they have to give you permission to do so. Well, we have two great people. I'm gonna say that two great people. I call them the dynamic duo, Dr. Catherine Williams and Miss Dolores Olson, which of course are the great experts in reference to anything that you can do because they also suffer from the same autoimmune disease as well. Lupus of Nevada, you can go to the website at lupusofnevada.org. And also, you can go to the YouTube channel, Lupus of Nevada, and as well as the Facebook page, Lupus of Nevada, on social media. So, we have some information that she's going to be sharing in reference to all things lupus and making sure that if you have any questions or inquiries, you can always go to the website again and also to the YouTube channel as well. You can make a comment there as well, and we'll be happy to reply. So, with that, back to you, Dr. Williams. Take it away.
Thank you so much. Hi, Dolores. How are you?
I am doing good. I'm blessed today. How are you doing?
Amen. I'm doing fine. Today we're going to be talking about, and I want to put a disclaimer here that we do advocacy and educational awareness. So the things that you hear on here is just educational awareness to give you a chance to go to your doctor and let him know this is what's going on. This is what is not going on. It gives you a little stick to hold on to, so you can measure and stick, so you can go back to your doctor and talk to your doctor about issues with your health. We're going to be hitting on lupus and heat intolerance, lupus temperature regulation, temperature for lupus in humans, lupus and body temperature symptoms. Can lupus cause excessive sweating? And let's just go right into it right now. I said lupus and heat intolerance. What's the connection? Yes, heat intolerance can be a symptom of lupus. Lupus is a complex autoimmune condition affecting various parts of the body. One common, let me see, one common yet often overlooked symptom is difficulty relating body temperature, and including heat. Reasons for the heat intolerance in lupus is fever is 36 to 86. And I'm getting this off the Health Line for those of you who'd like to use that as a resource. Health Line, health conditions. Fatigue, around 80% of lupus patients report fatigue, and heat can make that worse. Some medications like cortisones can affect how the body regulates temperature. Skin issues, lupus can cause skin rashes and worsened by heat. I had just recently had to go to my dermatologist, and she gave me some ointment to put on my skin, because when you're out there in the sun, you don't want to be, but if the sun is shining bright on you, um, this this is something you can put on your skin to help you from being blistered, because I get really blistered. We used to call ourselves vampires with a soul, because we'd get blisters that would just pop up, and it was just it just hurts. That's the bottom line. It just hurts. Okay, signs of heat intolerance in lupus is fatigue and heat exposure, dizziness, and headless, increased joint or muscle pain, skin changes such as redness and rashes, nausea and headaches, cognitive difficulties, which is brain fog, night sweats, and sleep disruption. Dolores, I'm going to let you hit on some of these in terms of fatigue and dizziness and how the heat affects you. Would you like to expound on that?
Yeah, sure. Definitely in the months of the when it comes to really high heat, like with me, I'll get like a skin rash, like little I find little bumps. They look like hives, and then also too, it makes me feel like me feel really weak. So I know when I'm
Mm-hmm.
feeling weak like that, that I need some water. So that's when
Mm-hmm.
you have to take
Stay
an elixir,
hydrated.
Stay hydrated. Yeah, then take those and take some water with electrolytes. You
Mm-hmm.
know, electrolyte waters. You know, they have the alkaline waters. You know, there's on the shelf. They have to grab something like that to kind of get you to get back up again because you know that's signs of you got to watch out with that signs of dehydration.
Mm-hmm.
And
Absolutely.
that's why, because
Absolutely.
when it's high heat, like I hear, California can be hot sometimes, well, not all the time, but even at 80 and 90, it still feels hot. It's still hot.
Mm-hmm. We have the dry
And
heat here in
yep,
Vegas.
and
We have
that's,
dry heat.
yeah, that's a huge difference with Vegas. Yeah, this is dry, dry heat. Yep, I knew that. I was a Vegas lady living up there for a long time. So I
Yes.
know about that dry weather out there. And out here we're close to the water, so it's
Yes.
like a
Mm-hmm.
huge difference when you're close to the waters. It's
Yeah.
much cool. It's much cooler on this side, but when you go out into the you know, to the other areas, it can be when it gets about there, it can feel hot, hot. So it's the main thing is to stay hydrated. Make sure you're drinking 6 to 8 glasses of water. You know, it depends
Mm-hmm.
on your it depends on your condition too.
What gets
Some people
me
can.
is the dress code. You know, wearing lightweight and breathable clothing is what we should wear in the summertime. But when you go, Dolores, into these stores, into these restaurants, you freeze to death.
Hello.
Always bring a sweater with you. I'm here. Can you hear me?
Yeah, it kind of blinked out for a minute.
Yeah, always bring a sweater with you because it stays so it's cold in the stores, you know. And avoid peak sun hours. Stay indoors during the hottest parts of the day, usually between 10 a.m. and 4 p.m. Plan outdoor activities during cooler hours and create a heat-friendly home environment. Now, I know not many of them probably did that. Um, I know for the 4th of July, they probably were out with family members and out in that heat, and that caused some fatigue, you know. But you know, the cooling techniques are fans, air conditioning, cool showers can help. Use cooling vests, deep limbs in cold water. Dip your limbs in cold water. Gradually cool. Bath, shower water. Minimize sudden temperature changes. Limit physical activity. I know you want to get out there with family and play volleyball. Medication considerations. Discuss with your provider how medications may affect heat tolerance and store them properly in hot weather. Now, going back to going in and out of these stores, I usually bring a jacket with me, a lightweight jacket, because when I go in the store, I know it's going to be freezing. When I come out of the store, I know it's going to be hot. So I let everyone know that's what they need to do, and that's what they should do, not need, should do. When I was running the lupus support groups, I let all of them know always have some water with a glass with crushed ice in it, because you can put that on your tongue and you could feel cooler. And that's what I did. When it's real hot out there, just get you that crushed ice, put it in your mouth, and you start to feel cool. It eases up that heat situation, you know, because living with lupus and heat sensitivity can be challenging, and this is challenging for us, you know. So we need to tell our healthcare providers to help us to develop a personalized care plan, and for us alone. So you can ask them that. But that's how I do it, Dolores. I go in and out of the store, and sometimes I count. I've got 3 things to do today. Like this morning, I was supposed to go to my acupuncture, and I've been having problems. I think I told you on both sides of my neck, the thyroid, and it was bad. And I knew not to get in that car to try to go anywhere, so I had to cancel the appointment for another day because when the heat hits, it does something. It makes you dizzy because you're taking those blood pressure pills. It limits your mobility, and you can go into a sudden stroke. So you have to be very, very careful of that. A lot of people who have never had a stroke, and I've never had a stroke. I've read a lot of articles of people having strokes and didn't know they had a stroke. And one in particular, who's it? Charlie Wilson had a stroke, and he didn't know he had one. You know what I'm saying? Multiple strokes. So we have to take advantage of the situation out there and protect ourselves. Do you agree?
Yes, definitely, because you got to protect yourself. Stroke is one of number one things that is sneaky, because there's a seven one too. A seven one. A lot of people don't know about the seven one stroke, which that's what my father died of. And you could have seven times and kill you. It kills you instantly.
Oh, wow.
And that because that's what they found out on his death. He had a seven stroke, seven times.
Wow.
And so a lot of people don't know about that sneaky. And
Yeah.
he was doing fine. You know, he was all joyful and everything. And then all of a sudden he said he was tired. And
Wow.
that's when the Lord took his breath.
Mm-hmm. Mm-hmm.
You know, and so that was the thing because he was breathing heavy.
Mm-hmm.
And
Mm-hmm.
so it's just so you gotta watch out. If your body feels normal, please go get it checked out immediately.
Well,
Because like I said, that's
go
sneaky.
ahead.
It's
Go
very
ahead.
sneaky.
Also, you may, with lupus, experience fevers with lupus in the summertime. People with systemic lupus, the most common type of lupus, often experience a low-grade fever, 101 degrees Fahrenheit. A fever may signal lupus flare and other inflammation or an infection. We have to be aware of that because a lot of us just keep going and we feel our forehead and, oh, I got a fever or whatever. We need to take our blood pressure. If you don't have a blood pressure machine, go into the store and get one. Go in the store and ask your pharmacist to help you, and ask them what is high, what is low, what should I be looking out for? And they certainly will help you because it's an increased risk of infection. It says people with lupus have increased risk of infection of all kinds. A fever may be a sign of infection caused by a virus, bacteria, a fungi. In people with lupus, immune system problems and treatment both reduce the body's ability to fight germs, respiratory infections, skin infections, yeast infections, urinary tract infections. So you got to stay, like you said, you got to stay watered up. Got to stay watered up because that's just so important. Because they said researchers show that up to 60% of fevers in people with lupus are due to disease activity of a lupus flare. And so we got to go back to that. We're not, I tell people, we're not the normal people. We've got to understand, we've got to look at our temperature and regulate our bodies. That's what I'm trying to say. Because that's very important, because we're dealing with lupus and heat intolerance, and we need to make sure that we know the condition of that. They also say that SLE often experience difficulty relating body temperature. When I go into my doctor's office, I usually have a temperature, my blood pressure 149 over 90 or something. She says high. That's because I'm in there and I'm scared to death. I don't know what he's going to say when he reads blood tests. And I told him that. So we just have to be aware of our own bodies. And when we talk about the temperature, when we have fever and chills and we're sweating, we need to talk about that. If you've experienced that, talk with your doctor so you can learn more about these symptoms, and lupus and overheating. Now, I've overheated before and had to go someplace and sit down because it's so important. Lupus, this is a big one here, Dolores. Overheating, thyroid disease, and lupus, and that's in the lupus corner. And it states that, let me get it. It states feeling hot. People with autoimmune diseases frequently experience heat intolerance. With the mercury rises, that means the body struggles to regulate temperature, resulting in a person feeling unbearably hot. It can result in symptoms like hot flashes, night flashes and sweats, excessive sweating, and that's so important. And this is overheating. First of all, individuals who have heat intolerance, in addition to always ringing when you're doing a show. Um, So they, let me go back. Lupus Corner conducted a poll of 530 members of the Lupus Corner community about the impact of environmental weather factors on lupus and symptoms. 77.8% of people with lupus agreed that environmental factors impacted the lupus symptoms. And when we talk about our thyroid, I know you get yours checked all the time. Am I correct?
Yes, I have to get a check every so many months.
Thyroid nodules, the lump in the thyroid. Um, Condition in which the thyroid gland doesn't produce enough thyroid hormone. It's just so important that we look at all of this. And now, do you have any problems with your medication with the thyroid? I know you've had. I'll let you tell it. You had issues with the thyroid, and you can expound on that in the heat.
Yes. With the thyroid, well, I know my thyroid, it could go up and down. In which too, I understand too, because I had mentioned too, part of when you're going through menopause too, it will mess up your thyroid as well. So it's kind of confusing,
Mm-hmm.
because that can happen too also. But so it goes up and down, up and down. Because at first they got me at 100, but what I was told years ago that I shouldn't be down to 100 because of that cancer I had.
Mm-hmm.
And so
Mm-hmm.
now I'm back up to 125.
Okay. Is that
And
high?
so
Is that high?
125, no, 125 is pretty good,
Mm-hmm.
because I used to be like, the highest I was on 300. That was years and years ago.
Do they call that hypothyroidism? Is that how you pronounce it?
Hypothyroid.
Thyroidism. Okay.
Thyroidism.
And
Uh-huh.
that's an overactive thyroid.
Yeah, overactive thyroid.
Uh
And
huh.
that's what happens because I had the first stage one at first,
Mm-hmm.
before I had radiation done.
Mm-hmm.
And so the first one was like, because I was getting so skinny. I was getting at the point of getting too skinny, and then they found out I was at thyroid. I had no, the thyroid one that was causing me to
Mm-hmm.
lose weight. I could walk to the
Mm-hmm.
corner and back, and then I lose weight.
Mm-hmm.
And so that was really,
A
messing
concern.
with my
That was a
vocal cords,
concern.
everything. Yeah. And so after that, once the radiation hits, once they choose to do that radiation, it turns into hypothyroid.
Mm-hmm. Mm-hmm.
And some people, it makes it hard for them to lose the pounds sometimes, but
Mm-hmm.
it just depends on the condition.
What is it called
I've been
again?
hypothyroidism.
Yes. Yes. Uh huh.
Yeah, and so like with me, I don't have to. I can still lose weight on. I just need to be disciplined more with the
Mm-hmm.
weight. Some people have to have a surgery removed.
What about menopause and lupus? Menopause and your connective tissue disorder. Do you want to talk about that with that menopause? Are you going through that now? The heat flashes, dizziness, fatigue.
Yep, I get that. Hmm. All
Okay.
the happy hormones of a changed mid changed life.
Night sweat. Night sweats. The overall
Night
heat.
sweats. Oh yeah, drive me
Mm-hmm.
so
Mm-hmm.
crazy. I take off my top. Say, I don't want that top on.
Do it when you're
It's
in your room.
that's what I'm talking about. Yeah, so that it could get so tired, but we have to have humor about when we're going through
Mm-hmm.
things. That's the
Mm-hmm.
best thing for
Mm-hmm.
healing. Some people say, "How do you get through?" I said, "I laugh."
Mm-hmm.
I said, "The
Mm-hmm.
more you laugh, it just make you just laugh about the silliest things." I was like, "Say,"
Absolutely.
and my mama calls me Queen, what she calls Queen Hot Flash, and I go, "Oh no, not that. You call me Queen Hot Flash."
Wow.
And so, that's the best thing to do it, because that's how I
Mm-hmm.
do it. Because well, when I first time, I was off the chain, off the rocket. When I first
Mm-hmm.
I was diagnosed with it years ago, and I found ways to figure out how to heal through it, understand that I'm going through it, And so that's how it's nothing but the grace of God that got me through it. That's one thing.
Good.
I just keep on this. I
So
just
you
just
had a
be funny.
team, right? You had a team. You had a, a team treating you, right? Because lupus people should have a treatment team. You know, your doctor, your other physician, your other physician. So there was a team treating you with the thyroid that you were going through. Am I correct?
Yep, that's right. That's right.
Mm-hmm.
And that's the best thing because see they caught it in time. Because if that cancer would have had spread, I wouldn't be speaking today.
Mm-hmm. Mm-hmm. Mm-hmm.
I've been yeah, the Lord would have had took my breath and I've been just waiting in the dust.
Mm-hmm.
Well,
You
that's
know,
what would happen.
it said, finally remember that hot flashes, overheating, and intense sweating episodes are challenging and exhausting. So you need to stay calm and talk to your medical provider about the symptoms so you can streamline the situation you're doing at home. Maybe you're doing too much exertion at home. You know, maybe you're out there shopping too much, you know, or you're out there in the sun. There's a lot of factors that play in the fact of, you know, lupus, menopause, and menopausal symptoms like lupus. There's a lot of that. Thyroid and lupus, all of it. So, Lupus Corner Insight surveys, we went over that. The summer months bring the heat and plenty of sweating and hot flashes. Many lupus warriors experience heat intolerance and at risk of overheating. Now, what do you do when you overheat? Can you expound on that?
I just take something cold, the drink, that's number one, and then I just wipe myself down, with something cooling. Or if I have
Mm-hmm.
to, I just jump in a cool shower.
Mm-hmm. Mm-hmm.
And that really good. I couldn't do don't do it with that hot. Oh no, it makes it worse.
Mm-hmm.
Like that. The best is this Luke cold.
Mm-hmm. Mm-hmm.
Not real extremely cold. This Luke cold. This
It's
little warmness with a little cold.
mm-hmm.
And
Mm-hmm.
that helps. And that bring down your temperature too.
Oh wow.
And
Yeah, I know.
it make you feel like you have a fever of 100 or something. I thought I was
Now,
having a fever. And then find
now
out it's normal, 97.
okay, because they go on to say people with lupus, practically, particularly systemic lupus, often experience low-grade fevers of 101 Fahrenheit, which may indicate a lupus flare, inflammation, or infection. Common infections affecting lupus patients include respiratory, skin, yeast, urinary tract infections, chills, often accompany fever, and can also occur independently, especially in cold environments due to blood vessel constriction of the Raynaud's phenomena, which is common in lupus patients. You know, so these are things that people should read up on and just get the gist of it because we're in the middle of a hot. I don't know if it's called. What do they call it? The monsoon. What is it? The moon.
Masoon, it's Masoon. Wait,
The heat. Yeah,
Masoon.
the heat because they said 5 people died in New Jersey 2 days ago because of overheating. You know, so there's around the country. There's a lot of overheating. There's a lot of floods. It's just, it is just, it's terrible. It's terrible out there, and so people need to know that they need to take care of themselves. You know, it's so important. You know, they can. It says, can lupus nephritis cause low potassium? Now we're getting on the kidney part. It says low potassium, also called, can sometimes affect people with lupus, and symptoms may include muscle weakness, heart palpitations, and extreme tiredness. Because there's some people out there that do have a lot of kidney problems, and they said potassium is an electrolyte. Potassium is electrolyte. My doctor, I was low on potassium, and they gave me some potassium that keeps your muscles, heart, nerves functioning well. Potassium levels are measured in units called milliequivalents or millimoles per liter. For adult normal for adult normal potassium levels range from 3.5 to 5.2 per liter of blood. Anything lower than 3.5 per liter is considered, you know, is considered, the doctor looks at it, you know. You got to look at it. Potassium levels of 3 leader is considered, okay, he has to look at all that. That's why those levels are like they are, 3.5, 5.2. It's so important when you go in your doctor's office and he reads your blood work. I know my doctors won't see me until I take my blood exam. To go in there for my blood, they will not see. The symptoms of low potassium include constipation, palpitations, when your heartbeat feels like it's fluttering or pounding, extreme tiredness, muscle weakness, muscle spasms, numbness. These are just so important. If you have severe low potassium, you need to speak with your doctor because it's just so important that you get the help that you need. Don't overlook your health, you guys. Don't overlook your health because it's so important. Many times, oh, well, that's okay. Well, I'll be okay the next day. I was having problems the other night and I thought it was going to go into a stroke. That's what I thought because I couldn't move my neck I talked to you, Dolores, about this from my left to my right, and I just laid on my back like I usually do and kept calm, just kept calm, because I was restricted from moving to my left to my right. And that's something that I'm going to have to talk to him about, my doctor, because it's so important that you write all these things down. You have your little journal, like you said before, Dolores, and you go in there with that journal and you let them know this is what's been happening to me. Can you give me some information on what I should do? I don't like getting additional medicine. I'm going to tell you that now, all the medicine I take. So, do you go into the doctor with your journal when you talk to him or what?
I usually do. I should be going in there with the journal. I've been doing it on top of my head
Mm-hmm.
lately, but I really suggest people to take a journal.
Mm-hmm.
Because that'll help you out a lot. And
Mm-hmm.
I think the next time I see my, I'm gonna take a journal too. Cause
Mm-hmm.
anything I'm feeling, whatever, if I'm feeling a certain way, I'm gonna write it down.
Mm-hmm.
And I say, hey,
Mm-hmm.
this is what happened about a week ago. If I had a week ago before the time to go, and let's say if my appointment was that next week, okay, write it down. Let's see what the doctor says about this. Because that's
Mm-hmm.
what our doctors are here for. Sometimes there experience that we do experience wrong physicians in our hands which we had to let them go. And we hate to
Mm-hmm.
let them go, but when they're not doing the job they're supposed to do and they're not
Absolutely.
helping us, then we have to let them go.
Mm-hmm.
And we have to find somebody else who is more knowledgeable because some of
Mm-hmm.
them are really not knowledgeable.
Mm-hmm. Mm-hmm.
I'm not saying some of them are real knowledgeable. They know A to Z, X, Y, Z, just like that. And some of them don't really know X, Y, Z like that.
Mm-hmm. And those of
It's
us that have lupus, we know it.
Yeah, exactly, exactly. And so that's the main thing, because one thing you want to make sure that you get the proper help because anything can happen. It could be heart disease, it could be anything. And if you have to go get that treatment done, if you found out you didn't, nobody wants to hear bad news. But if you really believe in God, He's going to help you through it.
Amen.
But
Well, the
all you do
physical
is just
signs of lupus, this is what they should be looking for. Fatigue is one of the prevalent symptoms, joint pain and swelling, especially in the summertime. Many individuals with lupus experience pain, stiffness, swelling in their joints, which can vary in severity and may affect multiple joints. Skin rashes like the butterfly shape rash, hair loss, fever, mouth sores, sensitivity to sunlight, Raynaud's, a condition it causes your fingers and toes to turn white or blue in response to cold or stress, indicating reduced blood flow. That's all important, so those are the causes of it. So any of those causes that you have, fatigue, joint pain, skin rashes, hair loss, fever, mouth sores, sensitivity to light, Raynaud's phenomena, you need to get to your doctor. You need to tell them this is what's going on. You may not have ever been diagnosed with lupus, but just listening to this podcast will give you some information that you can go back and tell your doctor, these are the things that I'm going through. This is what I'm going through now. How can you help me? So, because I go through the hot flashes too. Matter of fact, I'm having a hot flash right now, but I know it's hot in here, and I got the air conditioner on, and I don't want the. And if the air conditioner, I can't sleep with the air conditioner on at night. I can't because I turn into a mummy. It's just like my bones just joints just hurt so bad I get numb. Some people can't do that. So it's something that we need to think about, because the flares, that are sudden, they worsen, the flares can worsen and they can also be assigned to increased activity. If your flares are so bad that increases activity in your lupus, you definitely need to talk to that doctor. You definitely do. It says if your flares are becoming more common or more severe, your lupus may be uncontrolled. Talk to your healthcare provider and make any changes in your flares so that you can access your current treatment plan. Again, a treatment plan is the best plan that you can have with you and your doctor. What are you going to do? How are you going to do it? Lupus treatment plan recommendations are remission or low disease activity, lower steroid use of biologics like the medications they give you. I'm not going to mention certain medication because I'm not advertising that. So that's what you can do, but you have to be aware because this is hot. This is hot summer now, and we're out there. You want to get under the sun, you want to get over there by the water, you want to do this and that. We're limited. We can't do that, because of the disease. We have to taper off, from whatever diseases we have, You have anything else to say on that by any chance, Dolores? You want to add
Yeah,
something?
yes, the main thing is taking care of our body, and so we got to take care of our bodies.
Mm-hmm.
That's is very important. We can't ignore the signs. I know we may sound like a broken album saying it over and over again, but this is something that we need to be sink and into our minds and to remember this because we
Mm-hmm.
want to live longer. You want to live
Mm-hmm.
longer, and the more you can take care of yourself through your condition and
Mm-hmm.
follow the rules of your health, through your
Mm-hmm.
health physician, and that the more better your progress as any form of diseases that you go through.
You can watch videos and resources and talk to people and call Lupus of Nevada, get on our website and ask us some questions because it's very important. When I first was diagnosed over 27 years ago, they only had one book in the in the library at the hospital. Go say something with that one book. So I pretty much had to um, train myself. You know what I'm saying? I had to go out there on my own and try to figure out what I could do. And that's with one eye closed when I went down to the library. When I came back up a few days later, my left eye went down. So I was physically blind for 3 months. I couldn't see anything, and they didn't know if I was going to get my sight back at all because I was impaired. And those are things that you need to be aware of if you're having problems like that, issues. Please be aware of that. Look at your body. Your body talks to you, it communicates to you. It will communicate more than your doctor will communicate to you and say, hey, something's wrong here. Go find out what it is. So we can't stress that enough.
Yeah, exactly, exactly.
I see Ed coming back on. Ed, are we through with our time?
Yeah, you got about a minute left.
Well, I'd like to thank everyone for listening to Lupus of Nevada, and I hope that you visit our websites. If you have any questions, please don't hesitate to ask us, and we will give you our information the best we know how, coming from individuals that have connective tissue disorders, lupus, and a variety of other things. So I want to thank all of you for listening and being a part. And tell somebody to get on and support us, follow us, because we need that. We need people to follow us. So
Yes.
please do that. Follow us.
And then you can also go to the YouTube channel, like and subscribe that, and of course, at youtube.com/Lupus Nevada. You can definitely come see other episodes of this podcast besides this one that you're looking at now. So you can see all of the different topics that they were discussing and talking about that can also assist and help you. So we want to thank everybody for this opportunity to share today on this Tuesday as we continue our growth series, as I said, throughout the month of July. And it's really going to be a good opportunity now that we enter the third quarter of the year. What we're doing with ourselves, how we're helping each other, how we're building up and growing in the community that we serve in. So, any last questions and thoughts, Dr. Williams?
I just want them to subscribe, I mean, follow us. We need the followers to follow what we're doing so we can continue to give the information out there that's needed.
That's correct. Mr. Lewis?
Be strong through the storm of life, and stay calm.
Yes. And we all have gone through some storms, but we got to know how to weather those storms and just put our hope and trust in God and what He can do for
Amen.
us, and continue to have faith and working faith at that. So you continue doing what you're doing. Keep moving forward. Don't stop. Don't look back, but just keep moving forward. And you'll see the of course the end of the rainbow at that tunnel. So we want to thank you all for this opportunity to share with this podcast, Lupus Talks. We're always going to be here, of course. We want to thank you. And again, you guys check out the website at lupusofnevada.org. You can always go there. I want you to support the cause, support the mission, and support each other as we continue to grow in the communities that we serve in, no matter where you are in this country. So we want to thank you. You guys have a great rest of your afternoon, blessed evening, and we'll talk to you again next time. Peace out.
Bye.
Like